put my talk into some sort of context in case there are people in the room that don't know my area of research, my very particular area of research is about organ donation and transplantation. And I just also want to preempt the acknowledgement of some work from two of my doctoral students, Dr. Lisa Doherty and Dr. Lynn Colburn, because I have drawn on some of their work in this talk. There are many, many angles that I could have chosen to talk about researching in the real world and the shared joy of discovery, and I hope to share some of that with you this afternoon. But I have picked out some particular aims for this presentation, and that's to look at the idea of observation at the root of all research. The relationships that the researcher and the participant need to develop during real-world research. And those two very important words in research, reflexivity and reflection. And within the piece about that, I will include something about insider and outsider roles, because certainly people studying at MSc level and above are likely to be working in their organizations and therefore will come under some of those complications that exist around that role. Of course, we couldn't talk about real-world research without mentioning ethical issues. And really, really important, and something certainly that has been an experience for my own research career, is having research mentorship. And I think I'm going to absolutely support what Janice was saying about the rewards and the joy and the tremendous things that you do experience and get out of a research career. I just thought also it might be helpful to just mention kind of the way that I see research. And I rather support the statement by Stake that says that the function of research is not necessarily to map and conquer the world, but to enable our beholding of it. So it's that wonder that we need rather than, rushing about and trying to do everything. It's actually being a part of the process and the beholding of the discoveries that we make. Now, an MSc, therefore, may be the first opportunity to engage in research. And there are options. You may be thinking about doing desk work in a rather safe environment, I would say, where you're assessing other researchers' triumphs and shortcomings rather than your own. Or you may choose to take that uncertain map and step into the human environment of what Sean described as a swampy lowland where situations are confusing and messy. And that, of course, applies to our real-world research. My suggestion is do not fear of crossing the threshold inhibit you. Young Martel, who wrote one of the most wonderful expositions of fear, I think, in his book, The Life of Pi, if you've had the opportunity to read that, suggested that fear is a clever, treacherous adversary. It goes for your weakest spot, and even if reason comes to battle for you, fully equipped with the latest weapon technology, to your amazement, despite superior tactics, reason can be laid low, and your anxiety becomes dread. It is irony that the thing you feared most, that scared you witless to start with, will be the very same which brings joy, rewards, purpose, and a sense of completeness and ambition. Thus, Murray Parks has urged researchers not to shy away from exploring difficult and painful situations, as an essential reference is required from which knowledge, understanding, and further research can gain stimulus, flourish, and continue to unravel the maze of emotion and human complexity. But where to start? Well, when I started my PhD, the following story was shared with our cohort, which has remained with me through the intervening years. And as all researchers' observation, we have to open our minds to that reality. So what I'd like to do now is tell you the story of Look at Your Fish. And this was written by Samuel Sque in 1874. And this is what he said. It was more than 15 years ago that I entered the laboratory of Professor Azazi, and I told him I had enrolled my name in the scientific school as a student of natural history. He asked me a few questions about my object in coming, my antecedents generally, the mode in which I afterwards proposed to use the knowledge I might acquire, and finally, whether I wished to study, what particular branch I wished to study. To the latter I replied that while I wished to be well grounded in all departments of zoology, I proposed to devote myself specially to insects. When do you wish to begin? He said. Now, I replied. This seemed to please him, and with an energetic very well, he reached from the shelf a huge jar of specimens in yellow alcohol. Take this fish, he said, and look at it. By and by I will ask you what you have seen. In 10 minutes I had seen all that could be seen in that fish and started to search for the professor, who had, however, left the museum. Nothing to be done but to return to a steadfast gaze at my mute companion. Half an hour passed, an hour, another hour. The fish began to look loathsome. I turned it over and around, looked it in the face, ghastly, from behind, beneath, above, sideways, a 3/4 view, just as ghastly. And then Samuel goes out to lunch and comes back. Slowly I drew forth the hideous fish, and with a feeling of desperation again looked at it. I might not use a magnifying glass. Instruments of all kinds were forbidden. My 2 hands, my 2 eyes, and the fish. It seemed the most limited field. I pushed my finger down its throat to feel how sharp the teeth were. I began to count the scales in different rows until I was convinced that that was nonsense. At last, a happy thought struck me. I would draw the fish. And now, with surprise, I began to discover new features in the creature. Just then, the professor returned. That is right, he said. A pencil is one of the best of eyes. With these encouraging words, he added, well, what is it like? He listened attentively to my brief rehearsal of the structures of parts whose names were still unknown to me. The fringe gill arches, the pores of the head, fleshy lips and lidless eyes, the lateral line, the spinous fins and forked tail, the compressed and arched body. When I finished, he waited as if expecting more, and then with an air of disappointment, you have not looked very carefully. Why? He continued more earnestly. You haven't even seen one of the most conspicuous features of the animal, which is as plainly before your eyes as the fish itself. Look again, and he left me to my misery. I was irritated, I was mortified, still more of the wretched fish. But now I set myself to my task with a will, and discovered one new thing after another, until I saw how just the professor's criticism had been. The afternoon passed quickly, and when towards its close the professor inquired, do you see it yet? No, I replied, but I'm certain I do not, but I see how little I saw before. That is the next best, he said earnestly, but I won't hear you now. Put away your fish and go home. Perhaps you'll be ready with a better answer in the morning. I will examine you before you look at the fish. This was disconcerting. Not only must I think of my fish all night, studying without the object before me what his unknown, most visible feature might be, but also, without reviewing my discoveries, I must give an exact account of them the next day. I had a bad memory. The cordial greeting from the professor next morning was reassuring. Here was a man who seemed to be quite as anxious as I was that I should see for myself what he saw. Do you perhaps mean, I asked, that the fish has cylindrical sides and paired organs? He was thoroughly pleased. Of course, repaid the wakeful hours the previous night. After he had discoursed most happily and enthusiastically, as he always did, upon the importance of this point, I ventured to ask what I should do next. Oh, look at the fish, he said, and left me again to my own devices. In a little more than an hour he returned and heard my new catalogue. That is good, he repeated, but that is not all. Go on. And so, for 3 long days, he placed that fish before my eyes, forbidding me to look at anything else or to use any artificial aid. Look, he repeated his injunction. This was the best lesson I ever had, a lesson whose influence has extended the details of every subsequent study, a legacy the professor had left me, as he has left to so many others, of inestimable value, which we could not buy and which we cannot part. Scudder surely had experienced the shared joy of discovery. However, pursuing a career in research is not for the faint-hearted. Researchers will experience knockbacks when bids fail and papers are rejected. Weekends, mine recently, disappeared under piles of paper, and you can be terribly sleep-deprived. However, the sheer thrill to write, as I have been able to do at the beginning of this week when I submitted the final report of a study funded by the Department of Health on bereaved families' experience of organ and tissue donation and perceived influences of their decision-making. This is the first. I was able to write to the Department of Health that we are pleased we have, for the first time, documented the experiences of a sample of families who donated via circulatory death criteria. We have also developed a unique framework for categorizing families' experiences and provided systematic evidence concerning private and public recognition of donation. These are truly occasions when, to click that sent key, happiness makes up in depth what it lacks in length. For me, in line with that wonderful poem of Mary Oliver's, I don't want to simply having visited the world. When death comes like a hungry bear in the autumn, I want to step through the door, full of curiosity, wondering, what is it going to be like that cottage of darkness? Now, Glynn and Richards noted that for all the science that underpins clinical practice, practitioners make sense of the world by way of stories. And one of the most powerful methods, therefore, of conducting research with human participants in the real world is through interviews. As Robson described, a conversation with a purpose. However, we know that interviews can only be successful, and you will only get the information you require if you have built a trusting relationship with your participant, as it's all about learning from participants rather than learning about them. Take the case of Lynn, researching the experiences of men who had treatment for testicular cancer. Lynn writes, one participant in the study, Julian, was very forthright in his manner and went through the motions of welcome. but I often came away from interviews feeling I had done something wrong, or that, intellectually, I was his inferior. I found solace, however, in the descriptions by Cartwright and Limaldi of researcher roles and participant relationships. They illustrated that at the start of a research relationship, the roles of participant and researcher are generally that of stranger-stranger, and that it takes time for the development of self-disclosure and to foster trust to create a friend-to-friend relationship, or at the minimum, researcher and participant. However, there seemed to be little progression from stranger-stranger relationship with Julian. During my 5th encounter with him at the 3-month post-treatment interview, an opportunity arose for me to ask him what he thought about the study research process, following which he outlined several factors that had caused him to be so frustrated and angry. He revealed that what he had found most distressing was the means by which he had been asked to give consent to take part in the research, which had been to ask permission to continue the study even in the event of a relationship breakdown between the couple. This was a stipulation at the time of gaining ethics approval, but Julian had taken great exception to this request, and after his explanations, I totally understand why. He commented, "Actually, I can say it now. I actually resented you asking. I didn't want to think about us splitting up or something, but that was a lot to do with my mental state at the time. I felt that there was an intimation that we could have split over it, and I actually felt quite angry." Julian explained that at the time of diagnosis, his relationship with his wife had been the only solid foundation he had to cling to, and the idea that cancer experience could destroy the sanctuary had never entered his mind until I had highlighted it. I had questioned something that was too painful at this time of crisis in this man's life. We then talked this through and other points with greater understanding on both sides, and the relationship became easier. I learned from this encounter and appreciated that at least we had reached a point where honest feelings could be expressed. However, it had taken time, an instance of open sharing and an evolving research relationship before meaningful human interaction and learning could occur. Now, interviewing also demands that the researcher has an active role in the production of data. Not only is the researcher the instrument of data collection, but the interview data is a construction between the researcher and the researched. And Cavalli, in his book, uses this idea of having, interviews. Clearly, therefore, there is a need for researcher reflexivity to understand the impact of their beliefs and values and predispositions have on shaping that encounter and the construction and interpretation of data. So now I'd like to just look at those, the reflexivity that takes place behind the idea of these interviews. Lisa exercises reflexivity during an ethnographic study observing nurses giving intravenous medication to patients within a cancer unit. She reflects from the insider perspective as her research was carried out in the trust where she worked as a consultant nurse for intravenous therapy. And these were her major concerns. Would I influence the data given my position within the organization? How might I influence the very practice I was to observe? How nurses might change their behavior in response to my presence? During the observation of practice, I assumed that because nurses still cut corners and didn't carry out care as per trust policy and/or procedure, that they had become used to my presence and that I was not influencing their practice. However, on reflection, I became more concerned. If these were the aspects of care that they were not concerned about omitting when I was observing, were there other more worrying omissions that occurred when I was not observing their practice that resulted in greater risk-taking? Could I therefore have been observing actually atypical behaviour? I had to move beyond the notion of researcher effect on the data and begin to acknowledge the apparent active role I as a researcher had had in the actual production of data. Nurses too have not only ethical obligation to their participants, but also their professional role of practice. They must ensure in undertaking research that priority is given to the dignity, rights, safety, and well-being of participants and those involved in the conduct of research. And Lisa again reflects on a rather tricky ethical situation. She says, during the period of observation, I saw nurses who did not carry out the full identification of patients prior to IV drug administration. To ensure that patients were receiving the correct drug and that the drug was being administered to the correct patient, I noted the name of the patient and the drug details when the nurse started preparation in the clinical room. I also consented the patient prior to the nurse administering the drug, so I knew the right patient was receiving the drug. Had I been unable to do this, I would have had to stop the nurse giving the drug. Fortunately, I was able to satisfy myself prior to each administration, and that this meant that I did not influence the process observed, but could question it during the interview to discover the rationale for admission. And she also talks about her role conflict with the researcher and her professional role. An issue I had during the observation was the guilt I felt sitting taking notes when nurses were so busy. Most recognize that nurse researchers observing in the clinical setting find it difficult, as it's hard to sit and not to help out, particularly when an area is busy. In study ward 1, I was asked to cannulate a patient and I said no and explained my role again. But then observed a doctor taking 3 attempts to insert the cannula and felt guilty for putting the patient through such a traumatic experience. On ward 2, I was asked to cannulate a very ill, distressed, needle-phobic patient who needed some urgent drugs, and I could not refuse to cannulate him. I also ended up in answering the telephone on a night shift when both nurses were busy. This also raised professional dilemmas, as I had a responsibility as a nurse to work within my professional code, which states that I am personally accountable for actions and omissions within my practice and must be able to justify my decisions. It was for these reasons that I left my role as researcher and acted in my capacity as a registered nurse. And I'd just like to share with you one reflection from a study that I carried out in America, where I went to a number of organ procurement organizations and actually looked at the correspondence between families that had donated organs of their loved one and also recipient families who responded to them. And I just wanted to share this with you because it just gives an insight into sometimes the difficulties that researchers working in the real world have to deal with. And just bearing in mind that I was 6 weeks in America away from all my support systems, family and academic support as well. Some of these letters were written to the National Donor Family Council as well. So what I said here was that I felt privileged to having been allowed to share in what for these families was a very poignant, ruthful and intimate experience. I had enjoyed the interactive process of relationships and valued the opportunity to glimpse into the lives of these people, although many of the stories were tainted with sadness. And the human condition is filled with curiosity that lends itself to a researcher's distraction to read, stay, and ponder upon the stories, and contemplate the sad circumstances that led so many young people to their deaths. I think here particularly of death by gunshot wounds. For example, the case of a 16-year-old boy playing Russian roulette with 5 of the 6 bullet chambers in the gun loaded. As a British health professional unaccustomed to dealing with such injuries, these stories were particularly harrowing. In the intensive care, they were always saying to me, "Oh, Maggie, you don't know what a GWS is, gunshot wounds." Also, the image of rope marks around the neck of one 12-year-old male, a hanging victim, who otherwise looks so perfect, lying in an ICU bed, is an image that will actually stay with me forever. At times, I was thankful for my comparative riches. For instance, I was deeply touched by a mother's story that she had written to the National Donor Family Council. And this is what she said. P was a 12-year-old suicide victim. I was there when he was hanging. The cop cut him down. He was a DOA. I remember him being dragged out dead. The police and I fought. I was a murder suspect. Interrogation for 2 hours. Then I got to see my child. I couldn't go alone. First his feet, and then his white body and purple lips. I received the autopsy report yesterday. He broke his spine and slashed his wrist, my firstborn. I only have a daughter now. I am sterile. She will be my only child. Paul is cremated and at home with us. Somehow I felt almost guilty that as far as I knew, my sons were home and well. Just moving on then to research mentorship, which I think is crucial to the development of all stages of a research career. And for me, this relationship started quite early when I attended my first session at the University of Surrey to start a post-qualifying BSc nursing. My first encounter with Justice Akinsanya was during a preliminary motivation lecture that was being given by his PhD supervisor, Jack Hayward. In the discussion that followed, I could not help but be impressed by the quality of the questions and answers that were generated from somebody at the back of the room. I heard Justice Akinsanya's voice before I ever saw him. As someone at the beginning of their academic career, I could not help wishing that one day I could have at the tip of my tongue the wealth of information and knowledge. As I say, I heard Justice's voice before I saw him, so I realized he was not British born. As a Jamaican myself, this fact also resonated with me, as I felt this foreigner had clearly achieved so much in nursing in UK. It may be possible for me to do the same. It was not until after the meeting that I actually saw Justice for the first time. There were many things that struck me immediately about him. His immaculately suited demeanor, his bright, enthusiastic persona, his impeccable manners, and most memorable of all was the bow tie. These qualities were part of the man and memories that I treasure and look back on with affection and pride. Justice became my academic tutor for the BSc program and was always a source of encouragement, urging one to push the boat out a little further, do a little better. The things I learned about Justice during my course were that he only ever saw the good in any situation and only spoke good about people. He had the ability to pull the good out of the direst of situations, help you to see it, and shake off all the negativity. Justice remains an inspiration in my professional life, and on some of the less bright days, I try to believe, as he would have, that the sun is still shining brightly and will soon emerge from behind the clouds. During his lifetime, I often came back to him for advice or to discuss aspects of my work. One of the best pieces of advice he ever gave me was to get my PhD, the most singular career-enhancing move I ever made. It seems strange that I carried out this work in an area that was to become important to him later, as I worked with families of organ donors. Justice was a kidney recipient, to try and understand what the experience of donation meant to them and how it affected their bereavement and grieving. He also told me that being a success meant continuing to be a success, something I have come to appreciate in my research career, that you're only as good as your last paper or project. It is now my joy, privilege and honour to share what I have learned with students and colleagues to acquire their best, their greatness. However, the final critique of that ontological excellence of their work must come from their audiences, practitioners in the field, and the persuasiveness of their arguments. And now, just in closing, having drifted a bit into the Jamaican bit, I will end on the note that even if several challenges are actually working against you, take a leaf out of this man's book. He was joking at the starting blocks. He reacted last to the gun. He ran against the wind. He didn't tie his pumas. He jogged to the finish line. He broke the world record. Then he danced and reminded us that being the best, again, Janice, should be fun. Take the plunge into real-world research. Dance in the wake of your research achievements. And remember, being the best should also be fun. Thank you very much indeed.